And hello, this is Dr. Latasha McWayne. I am doing a presentation today on suicide and suicidal ideation overview. So, this is information and research that I did in regards to talking about suicide and talking about suicidal ideation. This overview is for supervision purposes. So, this is basically talking about suicide and making sure that we understand what suicide is and what suicide ideations are, and making sure that we're getting information out there that is accurate. So, moving right along, we're talking about the overview of suicide. So, suicide is a leading cause of death. Suicide is, caused by, I'm sorry, suicide is death caused by injuring oneself with the intent to die. So a suicide attempt is when someone harms themselves with an intention to end their life, but they do not die as a result of their actions. And when we look at every year, there are a lot of people that end up taking their own life. A lot of times there are more people who attempt suicide again, which is them, trying to harm themselves, with the intent to end their life, but they do not die with this action. Every suicide is is a tragedy that affects the families, communities, the entire country, and has a long lasting effect on the people they've left behind. So, for the most part, when we're talking about suicide, we really want to make sure that we understand that suicide occurs throughout the lifespan and was the fourth leading cause of death among 15 to 29 year olds globally in 2019. Moving right along, we're talking about suicide in a major public health concern sense. Basically, suicide is among the leading cause of death in the United States. And this is based on recent uh, morbid the data. So basically, the mortality data. Basically, suicide in some populations is on basically on the rise. So a lot is happening right now. We're talking about suicide. So I think doing this type of supervision session presentation makes sense to have some good information out there about suicide and suicide ideation. So basically, suicide basically taking your life is a tragic reaction to the stress of life situations. So there's a lot going on in people's lives when they turn to committing suicide. And then a lot of times, all of the more tragic, because suicide, it can be prevented. So it's really a thing that we know can be prevented if there is some, steps put in place and things of that nature. So whether, basically you're considering suicide or know someone who is feeling suicidal, basically you can learn about suicide warnings and signs. And also you'll be able to think about how to reach out to immediate help to get that professional help, professional treatment, as well as saving a life of someone or saving your own life or someone else's life. So, having some idea or some background information about suicide, the overview of suicide, I think is a great thing to have in your toolbox, some great information to have in your toolbox. Okay. So when we're looking at suicide overall, I did go back and looked at Emil Durkheim, the term suicide, basically from all the cases of death resulting directly or indirectly from a positive or negative act of the victim. This is information that comes from Emil Durkheim does have a book called Suicide, and it's a reading that I know I read it in sociology when I was in college, so it was something I wanted to mention here. But basically, the identification of four different types of suicide were touched upon the egotistic suicide, the altruistic suicide, the um, anomic suicide, and then the fatalist cystic suicide. So, with all of these, I'm not going to go into great detail on them, but the egotistic one is definitely talking about the absence of social integration. So, basically, individuals that who are like social outcasts, being alone or an outsider, those individuals can have some concerns when we speak of suicide. The altruistic would be when the social group involvement is too high. So there's so much going on. They're always out and about. Their life is full, got a lot of stuff happening. And I believe that one for me would be saying like the person, it's a lot of stress, it's a lot happening for them. Um, and then when we move right along, we're talking about the anomic suicide, which is the lack of social regulation, basically occurring during high levels of stress and frustration. Yeah, so basically, sudden unexpected changes in situation and things of that nature. I think all of these, definitely make sense. That's why I wanted to put them in this research. And then the fatalist can't say it right. Fatalistic suicide is when the individual are kept under tight regulation, and then there is an extreme that these individuals are placed under extreme rules and high expectations that's placed upon them, and then basically kind of get them to a point where it's just not, you know, feasible for them anymore, and they feel that they are destined or by faith to be in such a condition and choose suicide as a means of escaping. So when we're looking at all of this, all the information from Emil Durkheim's suicide, it gives us a basis, also gives us a degree of being able to figure out kind of what's going on when we're talking about social integration and more regulation. So good read. I will say that. So um, going into the definitions of suicide, talking about suicide is defined as death caused by self-directed injury behavior with intent to die as a result of the behavior. A suicide attempt, again, is a non-fatal, self-directed, potentially injurious behavior with intent to die as a result of the behavior. A suicide attempt might not result in injury. Suicidal ideation refers to thinking about, considering, or planning. So people sometimes get to the point where they're thinking about it, considering it, planning, and thinking, what do I do next? Or, how can I just, escape the situation? So leading cause of death in the United States, basically suicide is that. And you see some statistics that we have here. Suicide was the 12th leading cause of death over in the United States, claiming the lives of 45,900 people. Suicide is the second leading cause of death among individuals between the age of 10 and 14 and 25 and 34. The third leading cause of death among individuals between the age of 15 and 24, and the fourth leading cause of death among individuals 35 to 44. So there's a lot to unpack there when we're thinking about these numbers. There were nearly 2 times as many suicides in the United States as there were homicides. So another thing is to know kind of the crisis and suicide lifeline hotlines. If you are in a crisis, you can call or text 988 Suicide or Crisis Lifeline. At 988, they're 24 hours, 7 days a week availability, and the Lifeline provides confidential support to anyone in a suicidal crisis or emotional distress. Moving right along and talking about assessments of suicide risk. So, a clear and complete evaluation and clinical interview with regard to the following are used to determine the need for suicidal interventions. So, suicidal ideation determine whether the person has any thoughts of hurting themselves, himself or herself. And then suicidal plan, if the suicidal ideation is present, the next question must be about any plan for suicide acts, a general formulation that more specific plans indicate greater danger. A lot of times we ask them about, their means, their ability to get access to this mean, and things of that nature. The purpose of suicide, determine what the patient believes his or her suicide would achieve. This suggests how serious the person has been considering suicide and the reason for death. Um, Moving right along, potential for homicide. Any questions of suicide must be coupled with any inquiry into the person's potential for homicide. So, asking about, individuals around them, things of that nature, because suicide can be, where homicide can happen too. It could be suicide, homicide situations. Protective factors, work with the patient to identify reasons for living, asking about personal relationships, future events, and long term goals. And then what would you do if you feel suicidal? Just really talking to them about that. What would you do if you feel suicidal? And talking about that and getting some more good information. When we're talking about suicidal symptoms, so suicide warning signs and suicidal thoughts include talking about suicide, or an example would be making such statements as, I'm going to kill myself, I wish I were dead, or I wish I hadn't been born. Also, getting the means to take your life, such as buying a gun or stockpiling your pills. Another one could be talking about withdrawing from social contact and wanting to be left alone. Having mood swings, such as emotionally high one day and deeply discouraged the next. Other things to think about when we're talking about suicidal symptoms is being preoccupied with death, dying, or violence. Definitely feeling trapped or hopeless about the situation, increasing use of alcohol or drugs, thinking pretty much changing normal routine, including eating and sleeping habits, doing risky or self-destructive things such as using drugs or driving recklessly. Also giving away belongings. We talk about that one a lot, giving away belongings and getting affairs in order when there's no other logical explanation for doing this. Saying goodbye to people as if they won't be seeing them again. Developing personal changes, developing personality changes, or being severely anxious or agitated, particularly when experiencing some of the warning signs listed above. And then warning signs aren't always obvious. They may vary from person to person. And some people may make their intentions clear, while others keep suicide thoughts and feelings a secret. So those are things to, consider and think about. Suicidal causes. So when we start talking about suicidal causes, suicidal thoughts have many causes. So most often suicidal thoughts are the result of feeling like you can't cope with, when dealing with and facing different situations. Also, seeming to be overwhelmed at some of these life situations that come up. If you don't have hope for the future, or mistakenly think suicide is a solution, or the other thing is you may also experience a sort of tunnel vision, where in the middle of a crisis, you believe suicide is the only way out. And from time to time, there may be genetic links to suicide. So people who complete suicide or who have suicidal thoughts or behavior are more likely to have a family history of suicide. Suicidal risk. Although attempting suicide is more frequent in women, men are more likely than women to complete suicide because they typically use more lethal methods, more fatal methods, such as firearms. Um, you can, you may also be at risk for suicide if you attempt suicide before, if you have feelings of hopeless, worthless, agitation, social isolation, or loneliness, experience a stressful life event such as loss of a loved one, military services, a breakup, or financial or legal problems. Having substance use problems, alcohol, drugs can worsen thoughts of suicide and make you feel reckless and impulsive enough to act on your thoughts. Have suicidal thoughts, and have access to a gun in your home or a firearm in your home. Have an underlying psychiatric uh, disorder, such as major depression, post traumatic stress disorder, or bipolar. Another one to consider is your risk factors to think about: having family history of mental health, substance use, suicide, or violence, including physical or sexual abuse; having medical condition linked to depression or suicidal thinking, such as chronic disease, chronic pain, or terminal illness; are gay, or excuse me, are lesbian, gay, bisexual, or transgender with an unsupportive family. We deal with that a lot. That happens. Are they're in a hostile environment? If things, those are other risk factors to think about as well. So that's why we do encourage those individuals to, try to work on being a most supportive environment that they can be in when, dealing with different types of thoughts and suicidal risk factors for the most part. Suicide in children and teens, that's something. So basically, suicide in children and teens can follow stressful life events. What a young person sees is serious, and a lot of times, just it might seem just minor to adults, but problems in school or loss of a friendship. In some cases, a child or teens, they may feel suicidal due to life circumstances that he or she may not know, how to talk about, or what to talk about, when to talk about, or want to even talk about. So having psychiatric disorder, including depression, loss or conflict with close friends or family members, and a history of physical or sexual abuse. Suicide in children and teenagers also, sometimes they may have problems with alcohol or drugs they might be using. Again, when we're talking about children and teenagers, physical or medical issues, for example, becoming pregnant, or having a sexually transmitted infection. Those can also cause some individuals having some thoughts of doing something to themselves, being a victim of bullying, being uncertain of sexual orientation, and reading or hearing an account of suicide, or knowing a peer who died by suicide. So these are things that our children are definitely dealing with in school now. I always tell people, it's a different world from when we were younger. Our newer generations, they're seeing a lot of different things that yes, these things will set a lot of them off, and they are dealing with the suicide of their peers in school nowadays. So starting an antidepressant and increasing suicide risk. So most antidepressants are generally safe for people. They're usually safe, but a lot of times we do tell people that there is a little warning box on the back of your medications, your prescriptions, or whatever. So in some cases, we do look at children and teens and young adults under 25 may have an increased risk of suicidal thoughts or behavior when taking antidepressants, especially the first few weeks after starting the medication and the dosage. So a lot of times they're under good monitoring and care, and parents or family members are there for that additional supervision that is needed if an antidepressant is going to be prescribed. And then we're looking at how to keep in mind that antidepressants are more likely to reduce suicidal risk in the long run of it, by improving the mood for the individual. So looking at some of the suicide complications, suicidal thoughts, and suicidal attempts take an emotional toll. So, for instance, you may, be consuming, maybe consumed by suicidal thoughts that you can't function in your daily life. And while many attempts suicide and are, it's an impulsive act during the moment in crisis, they can leave you with permanent, serious, severe injuries. Also, there's also times where people have gone into situations where they try to commit or try to do something to themselves. Organ failure can occur, brain damage can happen. A lot can really happen with, having a suicide attempt. Also, for those left behind after a suicide, people known as the survivors of a suicide, pretty much there's a lot of grief, anger, depression, guilt. So, those things are very common for individuals. When we're looking at suicide related activities and characteristics, we're talking about numerous activities are associated with suicidal potential, including the following: making a will, getting the house and affairs in order, unexpected visits, visiting friends and family, and then also purchasing a gun, a hose, or a rope, writing a suicide note, visiting a primary care physician. A significant number of people see their primary care physician within 3 weeks before they commit suicide. Suicide related activities also and characteristics. Suicidal individuals have a number of characteristics, including the following: a preoccupation with death, a sense of isolation and withdrawal, few friends and family members, and emotional distance from others. Um, Definitely distraction and lack of humor. They often seem to be in their own world and lack of sense of humor. They focus on the past. They dwell on past loss and defeats and anticipate no future. Their voice, they voice the notion that others and the world would be better off without them. Haunting and dominated by hopelessness and helplessness. When we're talking about prevention, we're looking at to help keep them from feeling suicidal, getting treatment, the treatment they need. Basically, if you don't treat the underlying cause of suicide, having the suicidal thoughts or whatever, then they're going to return. So you may feel individuals may feel embarrassed about seeking help, treatment for mental health problems, but getting the right treatment for depression, substance misuse, and any other underlying problem will help you to feel better about your life and keep you safe. Also, establishing your support network. It may be hard to talk about suicidal feelings, and your friends and family may not fully understand why you feel the way you do. Reach out for help anytime. Make sure that people who care about you know about what's going on and are there for you when you need them. And also, you can think about um, getting help from places of worship, support groups, and community resources. Feeling connected and supported can also help reduce suicide risk as well. More prevention, talking about, remember, suicidal ideations are temporary. If you feel hopeless or that life is not worth living, remember that treatment can help you regain your perspective, as well as, life will get better. So taking one step at a time and don't act impulsively would be a great thing to think about when, we're talking about prevention. And then the mental health status review. So looking at following patient characteristics and mental health status review is designed to focus on the evaluation of any of the individual potentially for individuals' potential for committing suicide. So the appearance, we want to definitely look at, the dress, the hygiene, whether they're taking care of themselves, whether they're depressed, disheveled, unkept, clinicians will assess to make sure, what's going on there. The physical evidence of suicidal behavior, such as wrist lacerations or neck rope burns. The affect is one specific concern, is a flat affect by the patient. So basically, we describe that as basically they're having the thoughts and plans of their suicide and self destructive behavior. So a lot of times we're doing this mental health status. I do it. I'm in the hospital emergency room. So I'm doing this with a lot of individuals that come through the hospital that come in for suicidal ideation, suicidal thoughts. We're also talking about their thoughts, trying to talk about it in pretty much three types of thought ranges, changes for the most part. So their major focus and concern, one, command hallucinations. We do talk about those, telling the patient that they need to kill themselves or they will kill themselves. The delusion about the benefits of suicide, family will be better off. And then also an obsession with taking his or her life, own life. The homicide potential, we do talk about that. We do talk about the judgment, insight, and intellect. We also, do questions there. We also talk about the orientation and memory, focus on this part of the mental status review is to determine if the person is delirious or have dementia. So there's a lot to go along with that too. So that's a mouthful. But when we start talking about interventions, we go into interventions for suicide patients should consist of multiple steps as followed. So we do talk about the individual must not be left alone. So they got to be under continuous supervision. Anytime that the patient may use to hurt, anything that they might use to hurt themselves or, kill themselves, anything like that, we need those things to be removed from the patient's access so they're not able to access them. So from the home, we need those things to be removed out the home. The suicidal patient should be treated initially in a secure, safe, and highly supervised place. Inpatient care at a hospital is often one of the best settings. And yes, that's one of the places, like I said, I work in the emergency room, and then we send them on to a hospital for inpatient treatment. Those areas, even the emergency rooms, are very secure and very safe and highly supervised. After the initial intervention, which usually includes hospitalization, it is critical that there be a plan that is ongoing, a place of ongoing management, managing the treatment plan. So sometimes they go to partial hospitalization. Some of them may go home and get some outpatient services. So a lot goes on there. What should I do if I need help or know someone who does? If you are someone has the warning signs of suicide, get help right away, especially if there's a noticeable change in the behavior. If this is an emergency, definitely call 911. Otherwise, there are 5 steps you can take. Ask the person if they're thinking about killing themselves, keep them safe, find out whether they have a plan for suicide, and keep them away from things that they could use to kill themselves. Also, be there with them, listen carefully, and find out what they are thinking and feeling, and help them contact the resources that can help them, such as calling or texting 988, the suicide crisis lifeline at 988. You can also chat through the Lifeline chat. And then for veterans, they can reach out to the veteran crisis line by calling 988 and then pressing 1, texting 838255, and then they can also chat with them as well. Stay connected, stay in touch after the crisis can also make a difference also. So mental disorders that come along sometimes with suicidal ideation. Some studies agree that suicide is closely linked to mental disorders. Of course, 90% of people who commit suicide have suffered from at least one mental disorder. Typically, what happens is mental disorders have been found to contribute to between 47 to 74% of suicide risk. So there's a lot more information there. I'm sure everyone can just read through some of that information. But moving right along, among 30 to 40% of people who died from suicide had personality disorders such as borderline or antisocial personality disorder. Suicide is often the cause of death by young people with eating disorders, also. So, considering that, as well as individuals that have schizophrenia. So, moving right along, the final here is pretty much the association has found that um, between suicide and anxiety disorder, but they have found an association between suicide and anxiety disorder. However, it is difficult to assess the influence of mood and substance disorder that are also often present in these cases. So a lot of stuff happening here. Comorbidity we're talking about with mental health disorder, substantially increasing suicide risk. So a lot of information there to kind of think about and dig through. We're talking about it. Prevention, suicide attempts is basically many studies have found strong link between previous suicide attempts and a history of self-harm and suicide. So about 25 to 33% of all cases of suicide were preceded by the early suicide attempt, a phenomenon that has more prevalence among boys than girls. So a lot to think about there, a lot to unfold. So it does give us a lot of perspective about what's happening in the studies here. Also, introspective studies found that 1 to 6% of people attempting suicide die by suicide in the first year. So, a lot to think about. Characteristics, personality characteristics. Again, talking more about suicide association with impulse is associated with impulsivity. So a lot of times it could be something that can happen that could, a suicidal process can take up to weeks, months, even years. The fatal transaction from suicidal ideation and suicide attempt to an actual complete suicide often occurs sudden, unexpected, and impulsively. So that happens amongst our adolescents. So difficulties with managing the various, often strong and mixed emotions and mood fluctuations accompanied by the confrontation of new or ever changing challenges in different domains is another risk for young people as well, for young youth and suicide. So a lot of things to consider and think about there. More with the personality characteristics that their behavior were characterized by a rather passive attitude, waiting for someone else to solve the problem for them. So, a lot of things going on here to consider. We're talking about people in events express their experience as totally black or white. So there's no in between with what's going on. Definitely, just a lot happening in individuals' lives when they're thinking about things. Low self esteem, a lot of insecurities going on, anger, aggression. A lot of things are happening, and the combination with being a perfectionist, having that personality of being a perfectionist. So a lot of things going on there. In conclusion, a lot of our youth definitely struggle with a lot of concerns, public mental health problems. Young people, they especially with our adolescents, are by nature a vulnerable group of individuals for mental health problems. While suicide is relatively rare in children, it is prevalent. Increasing, it is the prevalence is increasing significantly with our adolescents. And we also have to think about the complex dynamics of what goes on and the interplays that, come up and contribute to the factor of it being a suicide. Also thinking about mental health, previous suicide attempts, personality characteristics, genetic loading, and family processes in combination with triggering psychosocial stressors, exposure to inspiring models and availability of means to commit suicide. Those are risk factors. And so here we have all of our resources that we went through and got a lot of this great information from. Again, I want to go back to one last slide here, and it talks about how to help someone. If we know they're feeling suicidal or having some issues, of course, we talked about calling 911. And then we also talked about calling the crisis hotline, which is 988. That's a suicide and crisis lifeline. There's also a chat line that they have, as well as the veteran assistance, veteran crisis line, which is 988 and pressing one. And then you can also text them 838255, and you can also chat with them. So I wanted to leave that information again if you know someone or you yourself are feeling suicidal. So I appreciate everyone listening to this presentation. Again, this is a presentation for supervision. I did not reinvent the wheel. I just got the information, compiled it, and wanted to put it out there for everyone to be able to hear it and listen to it and study it and go back and feel comfortable with it and feel like they have a grip on suicide and suicidal ideation overview. Thank you so much, and I hope you have a wonderful day.